Living Well, brought to you by Christus Cabrini Hospital.
We're visiting the Christus Cabrini Cancer Center. Joining us today is Dr. Larry Menache, a radiation oncologist. Here comes the sun.
Absolutely. It's time to start watching what we do out in the sun, because sun exposure is the #1 cause of skin cancers. And we have to remember that skin cancers occur in places where our skin is exposed, like our face and our hands, our ears, our top of our heads, that sort of thing. But skin cancer can also occur in areas where the sun has never really shone. So what that tells us is that while sun exposure is the #1 cause of skin cancers, there are other causes as well, or other factors that go into it, such as if you're dark-skinned, you can still get skin cancer, and it is more commonly found in areas where the sun doesn't shine, okay? Or like underneath your nails and things like that. Whereas those of us who are more fair, we can get skin cancers where the sun shines. So the main thing that we have to do is we have to protect ourselves, and there are many ways to do that.
Okay, but I guess you're also seeing it at much younger ages as well.
Absolutely, because young children are going out into the sun and not getting sunblock put on them. And the sunblock that you use is very, very important. You must use an SPF of 15 or more, okay? But the SPF only is for one type of UV ray, okay? So you've got to make sure that your sunscreen is for both UVA and UVB. Okay. And you should also have waterproof the sunblock. You should put it on every 2 hours, particularly if you're out for exposed periods of time, you're sweating or in the water, you should definitely put it on every 2 hours.
Tanning beds.
There's no such thing as a safe tanning bed. And today they're coming out with what they call safe tubes in the tanning beds. They are not safe, okay? And they don't protect you against UVA, okay? Which is one of the type of ultraviolet rays that you get, and the UVA actually penetrates deeper than UVB. Okay. So you really just don't need to be in a tanning bed. Go buy a can of spray-on tan and use that. Or just go natural, which, today everything is about natural food, organic foods. Why can't we have natural skin?
That's right. Okay, what about what to look for on our bodies? How do we check ourselves out?
Well, we should check ourselves out once a month and go to our doctor once a year and have him do a whole body check as well. If you have moles, particularly large moles, you need to check for changes in shape, size, color, or their irregular borders. If the borders become irregular and they weren't irregular before, you need to have that taken a look at. You should also watch if you have something called actinic keratoses, which are kind of those lumpy spots you get as you get a little bit older. Those can sometimes change into cancerous type things as well. But in general, just check your body for any changes like that. Let your doctor know what's happening. But otherwise, stay out of the sun. Wear protective clothing. A t-shirt will allow 1/5 of the sun's rays to go through, okay? Whereas a pair of jeans only allows 1/1700 of the rays to go through. So the thicker your protective clothing, the better you're going to be able to protect yourself from the damaging rays of the sun.
Let's talk about vitamin D, because obviously the sun is a very good source.
Right. The sun is an excellent source of vitamin D, but you can also buy vitamin D, okay? So being out in the sun is an excuse for getting vitamin D and fixing your calcium and all of that. That's a lame excuse, basically. You can get it in milk, you can get it in dietary supplements. There are many ways of getting vitamin D that don't put you at risk for skin cancer.
For more information, call 318-448-4964.